the topic I present today is to focus this type 2 implant placement 4 to 8 weeks after the tooth extraction. There are some advantages of type 2 implant placement that are we could have the additional soft tissue volume to allow us for easier attainment for tissue tension-free flap closure. And also, we could have the additional soft tissue volume may enhance our soft tissue aesthetic outcome. The flattening of facial bone contour may cause the peri-implant defect, often present 2-wall or 3-wall defect that are favorable for the bone augmentation procedure. We could also remove the pathology that associated with the infected tooth. So Professor Boozer have mentioned the biologic rationale and surgical procedure yesterday. The procedure he mentioned including to place the implant in 3D right position and then put a layer of autogenous bone graft to cover the implant exposed surface, then put another layer of the proteinized bovine bone mineral to overbuild the buccal contour, then cover with 2 layers of collagen membrane to stabilize the bone graft. So this contour augmentation technique have been published in 20 cases in Swiss population in 2009. All the 20 cases show stable facial soft tissue contour and stable peri-implant bone level. 6 years then, all these 20 cases remain extraordinary facial soft tissue profile, and almost no recession was noted. The combined CT image also shows stable and adequate facial bone thickness. If we read the article that published by Dr. Lau, that screening 170 combined CT image in Asian population, the result will show that it would have 34.7% implant will penetrate the maxillary anterior ridge if we place the implant in 3D right position. And the other article our team published in 2015.